I wanted to become a cardiologist. That is the glamour of having a stethoscope, listening to the heart and curing the heart problems in the 1970s. And I happened to meet with Dr. Stuart Krause, oncologist at Weiss Memorial Hospital. I treated a patient in 1975 with ovarian cancer that did not leave the hospital for almost 2 months after the surgery. And I was supposed to give the second cycle of chemotherapy after the first cycle lasted 4 weeks of hospitalization, and I refused to give the treatment. Dr. Krause sat down and talked to me. What would happen if you do not treat this patient? That patient will probably never leave the hospital and die. Then 6 months later, when I saw her in the outpatient clinic, she was doing remarkably well. There was no swelling of the abdomen, no nausea, vomiting. She had beautiful hairpiece that she was wearing, and the hair had not come back. But when I saw her, I decided that's the field that I should go, because there is a lot more to be done in this field than necessarily in the cardiology. In oncology, patient, when they got sick with cancer, nobody wanted to put them in the intensive care. It's taboo, like, you got cancer, don't put the patient in the intensive care. And the patients were treated in the regular wards even though they were sick. And seeing a patient that would have never left the hospital as in the outpatient changed my whole career to say there's a lot more to be done in oncology. When I started this office in 1981, the care was fragmented. And now we have not only the lab, X-ray, CT scans in the office, we also have the PET scan that can be done in our office, along with radiation therapy that can be given for the patients, and chemotherapy, and the latest of the chemotherapy with the non-available chemotherapy drugs under investigational studies with research in the same place. And patients can also take the prescription drugs from the pharmacy dispensed and go home, so they don't have to make 5 to 10 different stops at different places. Not only the patients are getting the best care and don't have to run around, patients' families don't have the extra burden of taking their loved ones to different places. We have diversity in our whole group. Every patient feels comfortable with different personalities, and I think we have different personality that is expressing in our group that will cater for all our patients' needs.